the main one is compassion. I mean, that's the most important one, is having compassion. I mean, because obviously, I mean, that to me is like that is the marker for someone really being in healthcare, is you having compassion and you caring for someone's well-being in its totality, not just, you know, they're with an ailment, but the mental health aspect of it as well, and just being able to kind of identify when a person is uncomfortable. You can kind of tell from body language, and maybe just their movements, having like that intuition when it comes to body language, you know, knowing that someone kind of crossing their arms and kind of shutting you out, you know, they don't want to talk about it.
I personally feel as though they shouldn't call, just by saying the name. I'm trying to think how it's, you know, the Mr. and Mrs. I don't like how when you go to our doctors, they say, Mr. Johnson, and just assuming that because the name maybe say Darren Johnson, it could be a girl named Darren or a transgender person named Darren. I think that the Mr. and Mrs., I think they should leave out the Mr. or Mrs. and just maybe call last names or first and last names. It's kind of like gender sensitive. They need some type of gender sensitive training.
I think that office staff and physicians and providers need to think about every step of the way for a person coming into the clinic for the first time or coming for the 50th time. It's not only how would you want to be treated, it's how does the person that you're serving want to be treated. That should be the utmost regimen of care. Not only, you know, greeting someone warmly and letting them know that they're welcome in the space, but also making sure that the staff is comfortable around people. You know, it's very palpable when a person is uncomfortable. You know, a trans person or gender nonconforming person is always very alert to how they're being received. And if the people who work in the office and work in the physician's clinic seem uncomfortable and seem like they're ready to kind of, you know, reject that person without any reason really, it's very, very easily felt. People are always detecting that. And so making sure that people are comfortable knowing that they can speak to trans and gender nonconforming people like they would speak to anyone coming in, you know, for help. And making sure people are comfortable with using language that's specific to trans and gender nonconforming people. Not assuming anyone's gender, letting people identify who they are so that then they can mirror that language. I am an HIV negative patient. However, that doesn't stop me from wanting to know more about how I can prevent HIV, you know, just being aware of my personal experiences. In the past, when I've asked questions about, you know, how can I make sure that I'm being proactive about preventing HIV, there have been a lot of assumptions about what kind of relationships I have or, you know, who I might be interested in having relationships with. The question that I got once was, well, why would you need to know that? You're not, you know, having sex with men, so why would you need to know that? Well, you know, because now we know, you know, it's not just about having sex with men. It's, you know, it's just a preventative measure for me. I want to know this is a part of my community. You know, I belong to the LGBTQ plus community, and HIV is something that is very prevalent that we need to know about, regardless of if we're having sex or not. So that was something that was troubling to me, just assuming, you know, why would you need to know this information? Well, I'm a human and I'm out here living, so I'd really love to know how I can keep myself as healthy as possible.